Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine, Kai Chikitsa, and MD in Ayurvedic Physiology, that is Kriya Sharir. For paid online consultation, you can definitely WhatsApp me on 9226810630. We are making the serial like a TV series, Ayurveda in GP, that is Ayurveda in general medical practice. And today's topic of discussion is epistaxis. Most of the thing you know that in the summer season, especially the children are playing the cricket outside or the any games, outdoor games in the hot sun, and they immediately somebody runs to your house and, oh mother, see this, my friend has started the bleeding from the nose. So bleeding from the nose is called as epistaxis. So I think most of the time we have to find out the exact cause. According to Ayurveda, this is a pitta prakopajanya vyadhi. That means excessive heat automatically generated and the bleeding starts. So pitta is a dosh and rakta is a dhatu. So first primary treatment is to stop the bleeding and then find out the cause, what is exactly, and try to treat the root cause. So this is a type of bleeding disorders. So you will have to check your bleeding time and clotting time. According to Ayurveda, this can be the part and parcel of the Rakta Pitta Vyadhi. Rakta Pitta is a bleeding disorders or blood dyscrasias. When the clotting factors are problematic, like for example, platelets are less, idiopathic, thrombocytopenic purpura, ITP. I have the separate video on this particular disease. Then there may be hemophilia, there may be purpura. So lot of concern problems may be adjoined or the connected with the epistaxis. I'm not saying epistaxis is because of that disease, but when there is epistaxis, you should be very careful what can be the root cause. We are here to discuss the Ayurvedic basic things and also basically the allopathic causes and investigations and the treatment. Dr. Deshpande is providing the lot of prescriptions, lot of medicine with concern to that particular disease. So epistaxis is bleeding from the nose. This is a part and parcel of the Rakta Pitta Vyadhi, Nasagat Raktastrava in Ayurveda, which is a Pitta dosha predominant problem. So this person should avoid working in the hot atmosphere. If it is a Pitta Pradhana Prakriti, very careful. Pitta Virodhi, Pitta Shamaka diet or the food stuff should be taken. Not too much spicy or the chili things he is allowed to take. Lot of teas, coffee, alcohol, which is a very bad for this particular problem of epistaxis. And we have to give the cooling and the Rakta Stambhaka Dravya, that is called as a styptic. The Vasa is the best plant or herb with relation to the Urdhvagata Rakta Pitta. There are different ways that you can get the bleeding from the nose, from the vomiting, hematemesis, from the sputum, hemoptysis, from the urine, hematuria, per rectal bleeding in the skin. So Urdhva Rakta Pitta, Adhoga Rakta Pitta, and Tiryak Rakta Pitta. Charaka Samhita, he has explained the principle of treating this Rakta Pitta Vyadhi. He said, Pratigama Shodhana. That means Pratimargam cha Haranam. If the Urdhvaga Rakta Pitta is there, one has to give the Virechana Chikitsa if it is having the recurrence. So whenever the person is having recurrence, please visit to the Ayurvedic Vaidya or come to the Ayurveda Academy. We can give the best treatment like a Virechan treatment and all concerned treatment. So what are the causes? Most common cause in the young people is not known, idiopathic. Here is the great capillaries, that is called as the Little's area, where even if you prick very harshly, that can start also the bleeding. As I have told you, the working in the hot atmosphere, working in the hot sun, that can also cause the epistaxis. In the older patient, especially 60 plus, 70 plus, you have to check immediately blood pressure. If the diastolic pressure is more than 110 mm of Hg, please don't forget to admit the patient because he will need some hospitalization and hospital management. Now, treatment, keep the patient in, of course, this I am very sorry to say, this is a treatment for the avoiding recurrence. In the acute attack, this whatever you are seeing on the screen is not at all should be followed. Not at all. This lying down position is not in the acute. When there is a recurrence and patient wants the rest after stopping the bleeding, then you can give this particular position. But when the bleeding is occurring, don't make him lie. Never, never, never. Correct this sentence. You have to bend down. Rather, ask him to sit in the chair. Ask in the stool. Don't lie. Don't lie down on the bed and bend forward and pinch the nose. pinch the nose like this. Pinching of the nose is very important to stop the bleeding from the nose. This is the first aid, Prathama Upachar, home remedy for epistaxis, bleeding from nose. You have to pinch the nose and ask the patient to take the breathing from mouth, even if he child, as much as possible. And also take a sterile cotton and try to make a wick and little bit over there. But basically, you must go to the Vaidya. You must go to the Ayurvedic or allopathic doctor, and he may do some what you can say the more proper treatment by sometimes even adrenaline is a medicine which makes a vasoconstriction, and that particular doctor will put specific treatment by putting some swab, cotton swab in the adrenaline and putting it over there. But that should not be done by patient. It should be done by the expert doctor only. Use of adrenaline swab. But this lying down position is not at all in acute condition. Please make this sentence very clear. Please make this sentence very clear. In case if there is a delay in the medical support, by chance home remedy, sugar water drops. This is a supportive treatment, but it has to be practiced, even I will say, better not by the patient, but better under the guidance of Ayurvedic Vaidya or in the Ayurvedic clinic. Okay, so sugar water, saturated sugar solution has to be put, and 5 drops here and 5 drops here by the dropper you can put, and also put in the swab each nostril every half hourly for 2 to 3 times. But this again should not be done at home by the common man. This is a treatment that the MD students, they are making such researches. Of course, this research is not bad. This is useful, but it has to be done with some experience. Okay. Then in case of the heavy nasal bleeding, pinch the nose, as I have said, for few seconds. Then very important, Prathamopchar or the first aid, put the ice packs on here, ice packs. Keep the patient sitting. Keep the patient sitting on the chair or on the stool. Don't ask to lie down. Okay. Put the ice packs on head, which is useful for stopping the bleeding. Then Naga Keshar 50 milligram plus this is anti-pitta, reducing the heat of the pitta. Pravala Basma 250 milligram, Kamaduda 250 milligram, immediate with some ghee, especially ghee is more useful in spite of the honey. Use with the ghee. Then also followed by the 3 times in a whole day he has to take this internal medicine. Then next is a put juice of durva. This is again the research matter which is available for the Ayurveda. But again, I will request better it should be done by the trained person or in the Ayurveda clinic, not by the person, layman at home. Don't waste this time. Then put the juice of durva, special grass for the Lord Ganesha. You have to make the juice of it, 2 drops, 2 hourly in each nostril, under the guidance of Ayurvedic Vaidya only. Then tablet Stiplon, very interesting tablet of Himalaya company, which stops the bleeding. Vasoconstriction is done, and heat of the pitta is also reduced, and the blood is stopped. Stiplon tablet, 2 tablets, plus Chandra Kalaras, 2 tablets, 3 times in a day as a follow-up. In case of the profuse bleeding, not responding to about treatment, consult ENT specialist or physician. And as I have mentioned already, adrenaline nasal pack can be given, or patient may need, very rarely, cauterization of this little area. Electric cautery is done to stop the bleeding by the vessels. For prevention, avoid forceful nasal blowing, especially in the common cold. Some people have the habit, lot of blowing. That is not correct. Harsh blowing is very bad in when you are having the flu. Okay. Do not insert fingers or any object inside the nose. If there is a tendency of epistaxis, stay away. Do not take apathya. Spicy, don't take. Hot food, excessive tea, excessive coffee, alcohol, smoking, drug addiction, pitta prakopak, ahar and vihar should be stopped immediately. Okay. Even excessive anger is very bad. Keeping late at night is bad. More screen time is also bad for the pitta prakopa. Working with the near of the heat, chemical factories, glass factories, strong sun, this is all the things are very bad. This is a very short video explaining you important emergency things that is happening in especially summer season or the October heat, epistaxis, rakta pitta problem and rakta dhatu problem. Please do care, take care. And for getting such knowledge, interesting knowledge, please don't forget to subscribe my YouTube channel and press the bell button icon to get the scientific but lucid type of information from Professor Deshpande. I am very thankful for you. Take care and see you in the next video.